A big concern, and they're fearful about their own safety and the safety of their loved ones.
It's the first time we've ever been truly scared to come to work. But despite being scared, we are trained to save lives, and we're committed to doing that.
We are in a crisis state. We desperately need help. I implore authorities, I implore government agencies, I implore the private sector to help us. We are putting our lives on the line.
Look, I got infected and I was wearing the protective equipment I needed to wear. We know that when we go in those rooms, and to further increase our risk of getting this virus and to further put our families at risk intentionally, which is what this feels like.
There are people that literally are wearing bandanas because they have nothing better than that to protect themselves from the respiratory droplets of patients who are infected with COVID-19. And I think that's a national shame.
It feels unimaginable potentially being asked to use bandanas. I can tell you we're not at that point yet in New York City, but I will be outraged if it gets to that point. I'm embarrassed to say this, but prior to this, my husband and I had never gotten around to writing a will, but this weekend that became one of our to-do list items.
I'm scared for my loved ones. Honestly, I'm being as candid as I can be. I'm no hero, but I'm not scared about myself. I'm willing to bargain my own safety, but am I willing to bargain the safety of my child and my mother-in-law? I think that may be a bridge too far.
And our Dr. Tara Narula joins us. Tara, we just heard one of the medical professionals say it's the first time they've ever been scared to go to work. What are they most concerned about?
Well, Anthony, last week when I talked to an ER physician, she told me that the thing that scares her most is leaving her kids without a mother. And that conversation about wills and code status, that's happening around the country with those healthcare workers on the front line. And they're really saying it's not a question of if I get infected, but when I get infected. And you have to understand, as medical professionals, we define ourselves with words like strong and calm in the eye of the storm. So for medical professionals to be saying that they feel panicked and afraid is really unprecedented. And they feel afraid for their own health, for their family's health, for the fact that they're going to have to be making terrible triage decisions about who lives and who dies. And if you've never seen somebody gasping for air, it is a terrible thing to witness. And knowing that all you can do is stand there and watch them because you don't have a ventilator to intubate them, that's heart-wrenching.
And that's why, Tara, it is so hard to hear that the medical professionals are afraid. So what steps can the hospitals do, can the government do to make sure that they get exactly what they need? What can be done now?
We need everybody to step in. And you heard David saying private companies are really moving on this. We need every single American who's listening to this and listening to the plea of the healthcare workers to figure out what they can do to help, in addition to the governments and the hospitals. We have healthcare professionals getting emails. I got one this week saying that we're going to be asked to reuse our masks for a day, for a week, until they get contaminated. You heard the discussion about bandanas and scarves. I mean, that's really horrifying. People are sharing on YouTube videos about how to ventilate a patient, more than one patient with one ventilator. So we need to do a lot more.
We need more.
Quickly.
We need more, and we hope we get it. Tara, thank you very much.